You're called code red to residence for an 80-year-old male who's unresponsive.
Where am I going?
A house.
Okay, so I'm gonna be worried about parking, so make sure there's a way in and out and the stretcher fits, as well as if there are any people there. And this could be a medical problem, this could be an arrest of some sort. It's just the one patient. Because he's unconscious, I'm gonna tier police, fire, and ACP, and PPE gonna don it all in case of resuscitation. So when I get there with my partner, are we greeted by anyone?
Yeah, the wife lets you in, brings you to the patient.
Okay. Is this the patient's position?
Yeah.
Did the patient look at us when we walked in?
No.
No. Is there any visible work of breathing or airway noises?
None that you can see.
How's the patient's skin color and condition?
He's pale.
He's pale. Okay. Hi there.
No response.
Pain?
No
Pulse?
response.
No? Okay. Feeling for a pulse?
There's no pulse.
No pulse. I'm just gonna get my partner to hop on compressions for me. And I'm going to update dispatch that we have a cardiac arrest and going to check on the fire, make sure they're en route.
Okay.
And then, can you set that for 2 minutes and then 1000? Got
Yeah.
whenever. And then, just ask my wife, when was the last time you saw your husband?
I was with him. He went
Today?
unresponsive like 10 minutes ago.
10 minutes ago, okay. So I'm just gonna put the pads on and we're going to landmark. And then off the chest. When I look at the screen, what do I see?
VFib.
VFib, okay, so back on the chest. I'm gonna charge to 200. Okay, off the chest, all clear. Shocking, shock deliver, back on the chest. Continue compressions for 2 minutes. Let me know when the 2 minutes is up.
Okay.
I'm going to look in the patient's mouth. Do I see any vomit, secretions, edema?
No.
No? Okay. So I'm gonna build my tree with the whole thing, the filter and the end tidal above the, yeah. So we're gonna try, our ventilation's good?
Yeah, they're combined.
Okay, make sure he's all perfect. And then just looking at him, do I see any trachea misalignment?
No.
No? Okay, and can I see his ankles? Does he have any peripheral edema?
No.
No? Okay, and is the wife still here?
Yeah.
Okay, but I'm begging him. That was part of it last time. Let me know and I'll squeeze when you do.
35, 36, 37, 28, 39,
1, 2, is the wife still here, you said? Okay, do you know if your husband was complaining of anything before this happened?
30. No, he just like dropped on the floor.
Okay, and what was he doing when that happened?
We were watching TV.
You were watching TV?
He went up
Okay.
to get a snack and just slumped over.
Just slumped over, okay. Was he, there was no complaints, he just got up to get a snack and then,
Yeah.
went out,
Just
okay.
fell.
Does he have any allergies?
No.
Okay, and does he take any medication?
I know.
No? Okay, well. Does he have prior medical history? Anything like this happened before?
He has COPD and asthma, but
COPD and asthma. 1, 2. So
the fire's here.
fire's through. Okay, so I'm gonna get fire to switch out with my partner and get my partner to come over on the airway. And I'm gonna listen. Let me know when you're gonna do ventilations, and I'm gonna listen. So you said no, just asthma and COPD.
Yeah.
Just okay. And
It's time for next analysis.
yeah. Oh, is it? Perfect. So I'm just gonna landmark of holes.
Yeah.
Okay, off the chest. When I look at the screen, what do I see? VFib. Okay, so I'm gonna charge to 300. Back on the chest. And then as it's charging, okay, can you come off the chest? Everyone all clear? Shock delivered. Back on the chest. And then just count out for me so that she knows when to give the 2 breaths. And our airway's still going in?
Yeah.
Okay. So, perfect. Do you know when your husband last ate?
3:24.
We had lunch together earlier.
30.
And the airway was, their
Yeah.
air entry was good?
Yeah.
It's equal?
Yeah.
And so, he just went up to get a snack. Never had anything like this happen before?
Nothing.
Nothing? Okay, and to my partner, let me know just when the 2 minutes is up again. Okay, so,
9,
Was he complaining of anything before he fell down?
No, he
No.
wasn't.
He wasn't, okay. Well, is there another fire here?
Yep.
Yeah, okay, so I'm gonna just help him get the stretcher set up and we're gonna bring it on over. So that we're good to go for transportation.
9:30.
I haven't been in this many of it. Sample, hope you hear. Okay. I just want to take a
28, 29, 30.
take a look at his pupils, just make sure they're what do they look like?
They're overactive first. Yeah.
It's been 2
15
minutes.
seconds till analysis.
Okay, so I'm just gonna landmark a pulse,
Yeah.
and then can you come off the chest? When I look at the screen, do I feel a pulse?
No.
No. And when I look at the screen, what do I see?
PA.
Okay, can you come back on the chest? We're not gonna deliver a shock, but we are going to transfer just because we've delivered shocks already.
Mhm.
So I'm gonna get the other fire to help me lift him up onto the stretcher as they continue. You guys are doing great. So we put him on the We put him on the stretcher and then we get in the ambulance. So it just seems like your husband's having a cardiac arrest. We are just trying to help him. We're gonna bring him to the hospital for the best treatment he can get. And then I'm gonna patch. So got an 80-year-old male, currently cardiac arrest. 2 shocks were delivered. He's now PEA. Will be like 10 minutes going to the closest hospital. Like that, my head wasn't in that for any of it.